Top federal Democrats were at the Senior Center in Waltham last Friday to cheer healthcare victories that benefit older Americans.
This is really putting seniors over special interests, seniors over politics.
The Inflation Reduction Act, signed into law recently by President Biden, will lower the cost of prescription drugs without raising taxes and offer additional relief. Congresswoman Clark invited Biden's Secretary of Health and Human Services, Xavier Becerra, and U.S. Senator Elizabeth Warren to the Senior Center. They were all in high spirits.
Starting this year, Americans are going to save about $800. Those who have their insurance through Obamacare, through the Affordable Care Act, because they won't see that their subsidies to help cover their costs will disappear.
Healthcare relief for seniors includes lowered insulin costs, a cap on Medicare costs, protections from cost increases amid high inflation, and expanded prescription drug coverage for low-income people.
But with this act, we're fighting back against today's high costs and real solutions that will lower prices in the short term and build a stronger, more just economy in the long term.
The White House and Becerra also recently announced that hearing aids will be available over the counter at pharmacies and stores across the country.
20 million Americans have hearing loss that could be helped by hearing aids, but fewer than 1 in 5 actually gets a hearing aid, principally because of cost.
The D.C. Democrats said all the coming benefits represent hard-won victories over healthcare monopolies intent on keeping costs sky high.
The industry has always pushed back. The industry has always won. This time the industry lost and seniors won.
I am in full favor of what's being passed, and I know it's only being passed through difficulty.
During a roundtable discussion, AARP officials and leaders from local community healthcare centers echoed the urgent need for lower costs amid spiraling inflation.
This is the number one issue that we've heard about from our members for many, many years.
If you are taking a branded medication for which there is no generic, and the copayment for that medication is, pick a number, $50, $100, etc., we absolutely have patients who are asking us what can they do to afford that medication.
For Waltham Newswatch, this is Chris Wangler.